we're going to continue on with our discussion of we're going to continue on with our discussion of malaria. We talked about how it is the largest killer and it also has a huge burden of disease. And this graphic gives you a sense of that. So the burden of disease is looking not only at the number of deaths, but what is the impact on that particular country? What is the resource impact? What is the healthcare impact? What is the economic impact? And this is looking at days of work lost from malaria, the estimated time lost by adults due to one episode of malaria. And it has a sampling of countries, but you can see it ranges anywhere from 2 to over 6 days. So just say we wanted to say 5 days was an estimated average time lost. That means every time someone has an episode of malaria, they're going to essentially miss a week of work. Now, as I mentioned, there are a variety of different types of strains of malaria, but you can have a strain where you have it for your entire life, and it just remains dormant. And it comes out of dormancy typically based on your immune system and whether or not it is compromised. Now, in the developing world, in many cases, their immune system is going to be compromised because they're not going to have the best access to healthcare. They may have other diseases. They may not necessarily have the best nutrition available. So they're probably going to have more episodes. So if someone misses a week of work from an episode, how many episodes are they going to have in their lifetime? Just say they have 20 episodes. That means that they're going to miss 20 weeks of work. Multiply that by the number of people that have malaria in that country, where there could be millions of people that have malaria. That is a lot of lost time. And that has a severe impact on the economy. And that's just from malaria. So add in tuberculosis or sleeping sickness or AIDS, the 3 other diseases that we're going to be talking about, or hepatitis or meningitis or dengue fever or yellow fever, or typhoid fever. It goes on and on and on. So you can have a better appreciation of the impact of disease on economy and on development. In many cases, one of the cheapest ways to attack malaria is with bed nets. And impregnated bed nets are a step up, and these are bed nets that are treated with insecticide. And it's estimated that about 25% of particularly child deaths from malaria could be prevented just by using a bed net. So it's a very simple thing that can be done that makes a huge impact. Relatively inexpensive. The cost of an impregnated bed net is about $10. Of course, it depends on where you're buying them, how many you're buying, etc. About $5 a year to retreat them. But relatively inexpensive, especially if they are donated or used and given out by a non-profit. They may seem expensive by the individual in that particular country. I mean, if you have a monthly average income of less than $100 or even less than $50, which is not uncommon in many parts of the less developed world, then $10 would be quite expensive. But relatively speaking, to the cost of treating malaria, it's inexpensive. And bed nets, in some cases, are more practical and actually work better than other types of eradication programs. With most diseases, if you kill the vector, as I said earlier, you stop the transmission. But when you're dealing with a disease that is so widespread among so many different countries, it becomes quite difficult. You know, in the United States, we've had cases of malaria. And if it reaches a certain number, we usually attack it head on. And it isn't long before there are trucks going down the street spraying. We could fly over and spray. We would basically kill every living insect alive. And it's done. But when you're dealing with countries where malaria is so rampant, so you not only have malaria in your country, you have malaria in all the neighboring countries, how do you stop it? I mean, you could have the best eradication program and you could kill every single living mosquito in your country. But then what's going to happen with the mosquitoes that are in the country next door? So a mosquito isn't going to fly around from the neighboring country, reach the border, and say, whoa, 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 well, we can't enter this country because they have an eradication program. So let's turn around and fly back to where we came from. It doesn't work that way. So the problem is, no sooner does the eradication program end, you have more mosquitoes coming in and it starts all over again. So the eradication program isn't just a one-time effort, let's dump all this money in and get rid of it. It would have to be ongoing, and then it becomes not very cost effective because of that. So you would essentially have to have all of these countries, all of the sub-Saharan countries, for instance, to get together to do it all at once. That's going to be virtually impossible, okay? Because you're talking about countries that may not necessarily get along with each other. There's a lot of corruption. I mean, it would be a mess. There's no way that would work easily. So sometimes things like bed nets or a vaccine, if one becomes widely available, would be much more effective. As of now, there are medications that you can take to reduce your chances of getting malaria, and medications that you can take once you have symptoms. But there is not yet a vaccine widely available. However, it is being worked on. So there are vaccines that are used for certain populations, so many in the military, for instance. But as far as I know, it has not yet been approved for general use, so that if you were going to a country where malaria was rampant, you could go to your doctor and ask for the vaccine. But I sense that is coming, because, like I said, it is used. There is one used in certain populations. Okay, tuberculosis, otherwise known as TB. Many of you are probably familiar with tuberculosis because you've been tested for it. And once we learn a little more about it, you'll know why. About 1/3 of the world's population is infected. Now, you might hear that number and think, oh, that's a lot. And it is. But there's a difference between infection and disease, which we're going to talk about in a minute. So there are many people that are infected that do not necessarily know they're infected, and that's why that is such a large number, because this is just a guess. Okay. Now, how is it transmitted? It's airborne. So you can't do a whole lot about it. How do you get tuberculosis? You stand next to someone who has tuberculosis. If you're in the vicinity of someone that has active tuberculosis, you are at risk. So like I said, there's not a whole lot you can do. There are a lot of diseases that are behavior-based. If you do this, you are more likely to get this particular disease, and there are things that you can do to prevent that from happening. But with tuberculosis, it's tricky when you're talking about airborne diseases. Now, with tuberculosis, it begins as an infection. So it is a bacterial infection. Now, we're going to be talking primarily with tuberculosis that will occur in your chest. Okay, so pulmonary tuberculosis, although you can technically get tuberculosis in other parts of your body. So it begins as an infection. Now, as an infection, you don't show any symptoms. So you may not necessarily know you have it. So you can have tuberculosis your entire life and never know it. Now, just like many diseases, when you're immune, you technically get tuberculosis in other parts of your body. So it begins as an infection. Now, as an infection, you don't show any symptoms. So you may not necessarily know you have it. So you can have tuberculosis your entire life and never know it. Now, just like many diseases, when your immune system is compromised, the TB infection, which is sometimes referred to as latent TB, then turns to active TB, sometimes known as TB disease. Now, when it is active and you have TB disease, this is when you show symptoms. And this is when you're contagious. So the good thing is you're not contagious if you're just infected. It has to turn active in order for you to be contagious. But it's again one of those diseases that is considered an opportunistic infection because it becomes active when your immune system is compromised. And that's why it's the leading cause of death in HIV, because of course with HIV patients, they have a compromised immune system. So many of them will die of TB. About 95% of all cases occur in developing countries or less developed countries, but there are definitely cases in the developed world. And this is why we're tested here in California. So you've all had the test where you go in and you get the shot. You go back a few days later, they look at your bump, you're okay, you're not okay. If you test positive, they'll usually take the next step where they do a chest x-ray or examine a sputum sample to make sure it is a true positive. And then if it is positive, you're typically put on a treatment program for 6 to 8 months and you're cured, essentially. So most people, even if it is infection and not disease, will do the protocol, the medication. You know, why would you not? Why would you wait until it turns to disease? So most will do that. Now, the testing is not mandatory in all states in the United States, but in California it is. So if someone in a classroom, for instance, had active tuberculosis, just by coughing, they could give it to everyone else in the classroom. We also have a lot of migration between California and Mexico. And Mexico has not only a higher rate of tuberculosis, but a higher rate of multi-drug resistant strains, which we'll talk about in a minute, which is another reason why it is important in California to have testing in environments where people are going to be in close quarters with each other. So with tuberculosis, the good news is that with treatment, you're typically cured of the bacteria. The problem becomes how do we get people to stay on a regimen of treatment? Because sometimes we can't even get people to stay on a regimen of antibiotics for 5 to 10 days. When you go to the doctor and you get a prescription for an antibiotic, it usually says finish all medication. And it says finish all medication because if you don't, there's a chance that you didn't kill every single thing in your body and you may relapse. And many times when you relapse, the strain becomes stronger and then you become resistant or immune to the initial drug and you need a stronger drug. So you have to keep getting something stronger and stronger and stronger. But a lot of people don't finish all medication. They have a theory of, well, I'll start taking the medication until I feel better, and then I'll stop, and then I'll save the rest for the next time that I'm sick, and I'll, self-diagnose myself, and I won't have to go to the doctor, and I'll be fine. So if we can't even get people to stick to a regimen of 5 to 10 days, how do we do it for 6 to 8 months? And this is where it can get tricky, because you're not talking about something where they're going to just hurt themselves, but if they get a multi-drug resistant strain from not being compliant with medication use, now they're putting everyone else at risk. So what do you do in that situation? How do you make someone take their medication? I mean, do you not let them leave their house? Do you put them in jail? What do you do? This is an ethical question. And there is a program that has been in place in many parts of the US and in other parts of the world as well that has been fairly successful in helping people stick to their regimen. And this is called Directly Observed Treatment, or DOTS. And it's predicted that millions of deaths could be prevented. And we have this program because non-compliance can lead to multi-drug resistant strains. So what it includes is detection of TB, 6 to 8 months of treatment, support to the patient, and then the key part here is the direct observation. So someone has to report to a doctor's office or report to a clinic and have someone watch them take the medication. And if they don't take the medication, then someone there follows up with them. So they essentially come to you. So they'll go to your house, or they'll go to your work, or they'll go to school, and they'll find you and go, oh, you didn't take your medication. Here's your medication. So in some cases it's controversial, but it's been very, very effective and can detect and cure up to 95% of infectious patients. So that's DOTS, which is an acronym for Directly Observed Treatment Short Course.